My name is Dr. Rob Silverman. I'm a functional medicine sports-oriented chiropractor from New York in the USA. I am excited to be here to present on this webinar. I'm hopeful that we'll be able to meet in person. We are filming this webinar during trying times, but I can tell you this, that when we get to speak, we're going to be better than we ever were before. I am making great use of my time. I have to say that I have never seen a more big opportunity for chiropractors than right now, because it's all about alternative health, and we are the leaders in lifestyle and alternative health, and nobody's better trained than a chiropractor for that. Having said that, I really want to talk about the gut-to-brain axis in health and disease. And I think we as chiropractors are extraordinarily trained to handle this super highway to health, if you will. So for me, the gut-to-brain axis in health and disease, it's all connected. Your gut, your microbiome, the trillions of bacteria in your colon, and your brain are closely connected through your vagus nerve. The gut-brain axis is basically an endless three-way call with messages constantly going back and forth. The vagus nerve is the carrier for all these essential communication. In Latin, the word vagus means wandering, an appropriate way to describe the path of this nerve. It starts in the back of your brain and runs all the way down to your colon. Along the way, it has branches that link to the larynx, esophagus, trachea, lungs, heart, pancreas, and most of the digestive tract, including your liver. Signals from the gut and from the microbiome travel up the vagus nerve and tell the brain what's going on down there, if you will. Signals from the brain travel down the vagus and tell the gut what changes to make in response. For example, when a vagus nerve fiber within the gut detect inflammatory signals given off by the gut bacteria, they pass the message to the brain. The brain responds by stimulating the production of anti-inflammatory neurotransmitters that regulate the immune system. When three-way communication is functioning well, the messages come through clearly. When the matrix is out of balance, however, health issues such as arthritis, diabetes, inflammatory bowel syndrome, food sensitivities, liver problems, inflammation, musculoskeletal disorders, and autoimmune diseases can arise. In the brain, neurodegenerative diseases such as Alzheimer's and Parkinson's disease can develop, as well as depression, brain fog, and other mental issues. So the real thing that we're going to discuss is what can drop the signals, what can restore the balance, what's going on in the microbiome, and how the microbiome, the gut, and the brain are so intertwined that their barriers are made up of the same protein. So let's delve in a little deeper. Sherry Rogers once said, "The road to health is paved with good intestines." My object every time that I speak, this objective it resonates with all my attendees. Number one, I want to take the science. There's so much science on this gut to brain axis. It's so exciting. And take that science and enable everybody to be able to bridge it to what I like to call Monday morning application. So if you've listened to this webinar, I'm hoping you have 1 to 3 different things to do in your life as a practitioner. In addition to that, I'm hoping you have 3 to 5 things to bring back when we get back to practice, or when you hear this and you're in practice, to imbue you with enthusiasm to make some changes to help everybody getting those health clinical outcomes that we all so want so badly. Now, this is my Dr. Rob's gut matrix. So I could basically spend the whole webinar and a whole seminar just on this. So let me try and give you some key takeaways in a very epigrammatic fashion. The gut. The gut is 90 to 95% of the small intestine. It's sort of a misnomer because it's so long. However, the reason they call it small is its diameter is very small, and the thickness of the small intestine, the barrier, is very thin. The thickness of that barrier is the thickness of a wet paper towel, but if you were to unravel it, the surface area would cover a tennis court to an American football field. Having said that, the large intestine, and again, a misnomer, very small, the large intestine is where all celiac disease and all these inflammatory diseases occur. It's large because of its large diameter. The gut houses 80% of your immune cells. It's where your macro and micronutrients are absorbed. So I always ask my patients, what have you done for your guts lately? Do you have the guts to be healthy? You must take care of your gut health. Your gut is a semi-permeable membrane. It allows specific things to go through to get into your bloodstream, like food, nutrients, and water. When your gut is damaged and becomes leaky, that's where the term leaky comes from, where it becomes more than semi-permeable and specific pathogens can pass, like viruses, bacteria, protozoa, and undigested food particles can pass your gut and they get into your bloodstream, which turns on your immune system. Because if it's not something that's supposed to be there, your immune system deems it foreign, and we have an innate immune system and ultimately an adaptable immune system, which is acquired. In that adaptable immune system, if things run aberrantly, and in the seminar, we'll go into more detail, you can have what we call autoimmune disease. So in the GI tract, because of leaky gut, you can have what we call food sensitivities. So food sensitivities can cause leaky gut. Leaky gut can cause a food sensitivity. I do a lot of food sensitivity tests in my office, and in that food sensitivities, I want to know what that patient is sensitive to so we can remove it during a specific seminar program, which we're going to talk about. In addition to the leaky gut, you could have an overgrowth of yeast and fungus. And one of the most common issues is something called dysbiosis, a leveling of good and bad bacteria. Surprisingly, you need about 85% good bacteria to bad bacteria to avoid dysbiosis. Now, when you have an overwrought of toxins going through your gut lining, 75% of those toxins meet the liver via the bloodstream. 25% of the toxins go from the gut to the liver via the portal vein. With those toxins going to the liver, you're giving the liver what we call a toxic chemical overload, leading to possible liver dysfunction. In addition to that, many functional nutritionists, chiropractors at the cutting edge, if you will, can't sometimes have the conversation. Do I do the liver first? Do I take care of the GI tract first? Well, in my seminar program that we're going to be talking about, we do it together to get a holistic approach to the issues. Leaky gut can lead to blood sugar problems, insulin resistance, pre-diabetes, and diabetes. Direct correlation. Tons and tons of literature will back that up. In addition, leaky gut leads to poor body composition, has an adverse effect because of the inflammatory factors towards obesity. Leaky gut, autoimmunity, thyroid issues. Leaky gut, musculoskeletal injuries. The gut releases something called cytokines. Cytokines release interleukins and lead you down a path of arthritis and joint pain. Also, at the time of damage at the gut, MMPSs, matrix metalloproteinases, your body's own proteolytic enzymes, are released, and they eat fibrocartilage and muscle. Hence, you have a direct correlation between the permeability or the excessive permeability of your gut and your musculoskeletal health. Many patients have heard me say when they come in with a rotator cuff that I'm without question going to treat their rotator cuff, going to treat them, but I'm also going to incorporate a gut protocol. And leaky gut, leaky heart. The release of LPS from your gut, lipopolysaccharide, which holds gram-negative bacteria on the inside. It's on the outside of the inside of the intestinal tract. When LPS is expressed through the gut, which is not supposed to, we call it an endotoxin, and a lot of inflammation occurs, one of which is leaky gut, leaky heart. And now the gut to brain axis. Bidirectional communication. Whatever you do to your gut, you do to your brain. Leaky gut, leaky brain. Gut on fire, brain on fire. Leaky gut, inflammatory neural degeneration in the brain. The gut barrier and the blood-brain barrier, as I alluded to in my intro, are made up of the same proteins. They're both single-layer epithelial cells. But the takeaway with the brain is the blood-brain barrier is supposed to filter 400 miles of arteries. If that blood-brain barrier is compromised and the toxin passes that barrier, there's usually neural degeneration and neural autoimmunity. So to keep in track and keep in tow In a pristine condition, we want our gut and our blood-brain barriers not only to communicate with each other, but also to be intact so toxins don't float in the bloodstream and communicate via, as we said earlier, the vagus nerve. Here's a beautiful symmetric slide where we see on the left side the tight junctions and the gut are in a perfectly, as I've used the term before, pristine condition. Toxins, microorganisms, gluten are not doing any damage at this time. When you look to the right, you see that the gut is now leaky, the tight junctions, the gateways are open, and all these toxins go through. They can damage the mucosal membrane cells. They get into the bloodstream. Once in the bloodstream, the body responds with an innate response and then ultimately an adaptive immune response leading to the release of immunoglobulins, IgG, IgA are two of the most common, IgM, B and T cells. Ultimately, this release can lead to nutrient malabsorption, autoimmunity, food intolerances, systemic inflammation, and blood-brain barrier breach. Here is a list of just some of the things that can damage the gut. Stress, adverse or dysbiosis gut microbiota composition, the toxic chemicals, the chemicals of the world, the chemicals that you use every day, medications just like NSAIDs, non-steroid anti-inflammatories, Aleve, Advil, ibuprofen. They do decrease pain, but they impair healing. And one of their most adverse side effects is these medications will damage the intestinal tract and the tight junctions. Inflammatory cytokines, undigested food molecules, lectins, and agglutins. Lectins like beans, peanuts, lentils, tomatoes, potatoes, eggplant, wheat, and other grains can also stick. Lectin means direct binding and damage the gut. Food coloring and even chewing gum all lead to the breakdown of mucosal and tight proteins, leading to intestinal barrier dysfunction, leading to food allergy intolerances, immune system abnormalities, ultimately leading to autoimmunity, having an adverse influence on the blood-brain barrier, and ultimately then neuroautoimmunity. Here's a list of medications that can contribute to leaky gut. Antibiotics, they kill both the good and bad bacteria. They are copper bombers. They clearly shift the microbiota diversity. NSAIDs, which we just talked about before, not only can they cause intestinal bleeding, but they damage the tight junctions. Birth control pills actually cause an increased level of estrogen, which lead to candida overgrowth, which ultimately contributes to leaky gut. Steroids actually shift the immune response and can perpetuate autoimmunity. And last but not least, antacids. These antacids actually decrease the needed gastric acid. They suppress the gastric acid, leading to possible gut infections and pathogenic overloads. Here's a slide that speaks real obviously to the idea of gut on fire means brain on fire. Brain on fire means gut on fire. Intestinal inflammation. You know, one of the biggest signs of intestinal inflammation is if you get gas and bloating after you eat. If you get gas and bloating, we're not supposed to, there are no pain fibers in our intestinal tract. Without those pain fibers, the only way our body can tell us that we're having some issues going in our gut is to give us gas and bloating. Have you ever had gas and bloating? Has any of your patients ever had gas and bloating? Typically after the gas and bloating, 30 to 45 minutes after that, you will see something which we refer to as a brain fog and some lethargy. That's because the neural impulses or neural firing to the brain has been dulled, and the brain now is not expressing any pain because there are no pain receptors in the brain. So gut on fire, gas and bloating leads to brain fog. There's also something called a silent leaky gut. Silent intestinal permeabilities, loss of integrity of tight junctions, systemic inflammation. The symptoms are depression, chronic pain, fatigue, endotoxemia, LPS, ultimately activating brain inflammation, depression. This is all due to overactivated microglial cells. Microglial cells are the cells in the brain. They're like macrophages. They clean out any toxins. Unfortunately, when they're overactivated, they become very deleterious to the environment in the brain. systemic inflammation activating an injured area, chronic pain, and LPS damages the mitochondria, causing fatigue. The gut-brain connection. Let's get into the root cause of a broken brain. Excuse me. 400 times the amount of messages from gut to brain than the brain to the rest of the body. It's over 1,000 species of bacteria in your gut, but it's only 3 pounds of bacteria in your whole gut. Yet there's trillions of bacteria in your gut. There's 2,000 genes in a human. There's 20 million bacterial genes. The bottom line is there's more bacteria than cells in your body. And as an FYI, the gut contains more neurotransmitters than the brain. About 93% of your serotonin starts in your gut. The gut produces vitamins, digests foods, regulates hormones, excretes toxins, and produces healing compounds. So to treat the brain, we must first remove the cause of inflammation, such as leaky gut. Chronic intestinal inflammation alters the hippocampus neurogenesis. Essentially, BDNF, brain-derived neurotrophic factors, which allow for brain neurogenesis. So the brain can reform axons and grow back nerves. 2013, literature was starting to dictate that neurological schools made that advancement. Goes back all the way to 1992. Having said that, the gut releases the BDNF. So what we found, and releases it to go to the brain. So what we've seen in this study, which really exemplifies it, is that chronic intestinal inflammation alters hippocampus neurogenesis, which is decreasing BDNF, which will lead you down a path of not having good cognition. And when we talk about concussion, it doesn't enable you to resolve any concussions, because you have to fix the gut if you want a concussion to resolve. My goal is always to detect specific things. I want to detect the triggers and remove them, and I always want to repair the barriers, which is our most innate immune system. Here we can see that LPS leads you down a path of leaky gut, and we have actomycin and occludin-zonulin. Occludin-zonulin proteins, when they're released, imply a ripping of the tight junctions. They're sort of the gateways in the gut. And actomycin means the actual gut lining is damaged and could mean autoimmunity in the gut. Ultimately, they're going to release serum antibodies, IgG, IgA, and IgM, not necessarily in that order. IgA, IgG, and IgM, let's discuss them a little bit. The first thing that you're going to see, which isn't depicted in here, is secretory IgA. That comes from the mucous membrane. You'll see that a lot, obviously, in the gut. You also see that in the lung. Very soon after that, IgM and immunoglobulin will be released, and that means early activation. Then you have a IgA. That IgA will mean that it's been reactivated. And then IgG comes in. IgG comes in about the 10th to 14th day. IgG, which is the most abundant immunoglobulin, 75% of immunoglobulins are IgG, and it is the only immunoglobulin that can pass the placenta. It means that you have, if you will, ongoing inflammation. So when you test for LPS with these immunoglobulin markers, you're going to find out not only do you have leaky gut, but it'll tell you the time frame in which your body's immune system has been attacking it, so you get a gauge on autoimmunity. Gut dysbiosis, too much gram-negative bacteria in reference to gram-positive bacteria, is usually one of the main causes for the release of LPS. Occludin and zonulin usually release tight junctions. They release, and you also have the serum antibodies. They're a tight junction cell damage. They're released from chronic gut dysbiosis, inflammation, stress, and our friend, non-steroid anti-inflammatories. Actomycin, which is damage at the gut level, usually just an IgA response. We'll speak about epithelial cell damage, and those causes can be chronic gut dysbiosis, celiac disease, IBD, IBS, and SIBO, which is small intestinal bacteria overgrowth. Systemic LPS is linked to multiple disorders. It's been shown to play a major role in disorders reaching far beyond the gut, Endotoxin LPS, or lipopolysaccharide, is carried by gram-negative bacteria, and as you see clearly from this slide, can damage some vital organs. But for this discussion, we're going to really focus in on the brain. So what's the big idea? What's my suggestion? Well, my big idea is my Super 7R action plan. If you have any damage to the gut, I'd like you to implement this plan. This is the basis of my answer for my upcoming book, The Superhighway to Health, 7 Steps to Optimizing the Gut-Brain Connection. It's right here. So reset diet. I'd like an anti-inflammatory diet. So my suggestion is I always use specific names and specific ways to remember things like GPS. So GPS, no gluten, no processed food, no sugar. Those are 3 things I recommend everybody stay away from for good gut health. Take care of your DNA in this acronym. No dairy, no nicotine, no artificial sweeteners. Reset. Also get some exercise, try and get a good mindset, because we are lifestyle specialists when it comes to it. So adhere to a good diet, lifestyle, and mindset. Then you want to remove unwanted pathogens. How are you going to do that? Well, specific nutrients like oregano oil take the bacteria out in the upper respiratory tract. Berberine HCl is a beautiful herb. It's known for your train wreck patients, your dysbiotic patients. You would want to remove those unwanted pathogens. Of course, you also remove them by adhering to a very staunch, stable, whole food diet. Just remember, a famous chiropractor called Jack LaLanne once said, if man makes it, I won't eat it. And I walk that walk and I walk that talk. That's what I recommend for all my patients. And last, in a remove phase, that's when you could add the detoxification support, help your liver detox so it doesn't overload your gut. And your detoxification support is also a great choice because you're removing pathogens and toxins. Replace. What are you going to replace? You're going to replace needed digestive enzymes and stomach acids. Stomach acids like betaine and HCl, digestive enzymes like protease, amylase, lipase for the pancreas. Most people have a digestive problem. R number 4, you're going to regenerate the damaged intestinal mucosal. So I like to heal and seal the damaged gut lining with a plethora of different needed nutrients, not including all, but okra, L-glutamine, NAG, glucosamine, HCl, alpha lipoic acid. Vitamin D is critical. There are receptors in the gut for vitamin D, omega-3 fatty acids. After that phase, we're then going to incorporate the reinoculation. We're going to reinoculate with quality pre and probiotics. I'm a big proponent of probiotics. I think probiotics are critical. As I talked about in my intro, it's the microbiome, and good quality bacteria is needed. So of course, with the diet, you'll get some. The probiotics need to be fed by the prebiotics. Great prebiotics in food are garlic, leeks, Jerusalem artichokes, okra. A great prebiotic in a supplement form would be XOS, xylo-oligosaccharides. The pre feed the pro, so you have a healthy environment. Then you want to reintroduce certain foods. If you did a food allergy test, I suggest at this point to do another food allergy test. In the food allergies, then you'll determine what that patient can put back in. Of course, never putting back in my opinion, gluten, dairy, and the such. And then ultimately, you want to retain their health. You want to retain your patient's health and their GI integrity. I'm a big proponent of letting them know there's the cycle. The cycle, or the stairway, if you will, is intestinal permeability or damage where you have too much intestinal permeability, leading to the release of systemic bacterial toxins, ultimately having blood-brain barrier permeability, leading to neuroautoimmune reactivity. So what's the next big thing? In all the things we talk about, what's the next big thing? Well, the next big thing is, as I talked about it before, the vagus nerve. There's truly 3 ways that the gut can communicate with the brain: the bloodstream, hormones, and the vagus nerve. So let's take a look at the anatomy of the vagus nerve. The anatomy of the vagus nerve is it goes from the brainstem, the medulla oblongata, down through the transverse colon and innervates many different organs in that pathway. Vagus nerve is cranial nerve number 10. They call it the vagus because in Latin it means the great wanderer, because it covers so much terrain. The vagus nerve is a highly afferent nerve. It's approximately 90% afferent. It attaches to the transverse colon, communicates with the microbiota through sensory. It senses what goes on inside the gut, something called toll-like receptor 4, which is a communication or a stimulant for inflammation, communicates with the vagus nerve, and the vagus nerve can signal health or health promoting signals, and it can also get shut down, which doesn't allow those health promoting signals. One of the biggest takeaways, and I want to say it here, that the vagus nerve does is it decreases peripheral inflammation. It's only 10% efferent on the way back from the brain to the gut. So here's the anatomy: medulla oblongata down through the transverse colon, innervating the neck, thorax, liver, pancreas, intestines. Vagus nerve is sensory. It actually communicates with the central nervous system, something that chiropractors know an awful lot about. The vagus nerve also is the captain of the ship of the parasympathetic nervous system. It also speaks to the enteric nervous system, and that's why the gut is called the second brain, because of the enteric nervous system. It has the largest accumulation of nerve cells in the body, the enteric nervous system, and ultimately regulates immune response, detecting nutrients and motility. The takeaway here is the interaction of the enteric nervous system, vagus nerve, leads to bidirectional communication. The vagus nerve is your rest and digest nerve and your wine and dine. So you know your parasympathetic and your sympathetic system cannot be dominant at the same time. It's more a balance. So when your sympathetic's too high, your fight or flight, your parasympathetics are decreased. Shutting down your parasympathetic nervous system, as an example with TBI or concussions, affects the normal functionality of the vagus nerve. It slows digestion dramatically through the mechanism of the migrating motor complex. The migrating motor complex is a peristaltic contractions which functions to move contents from the stomach, from the small intestine to the large intestines. In a normal, healthy individual, the migrating motor complex has 9 to 11 waves daily. In other people who have conditions like SIBO, it only has about 3. The vagus nerve is essential for proper migrating motor complex function. Low vagal tone, when it's decreased, is seen with people who have irritable bowel syndrome and irritable bowel disease. In addition, low vagal tone decreases the secretion of hydrochloric acid, pancreatic enzymes, and reduces bile secretion, which is a critical element to allow for specific objects and food bolus to move. So the takeaway here is the targeting of the vagus nerve through stimulation would be of interest to restore homeostasis in the microbiota gut to brain axis. The vagus nerve stimulates dramatically a reduction in inflammation via the release of acetylcholine, which is a transmitter or a neurotransmitter, which is a chemical released by a nerve cell or a neuron. It also reduces inflammation, like we said, shows an improved outcome in rheumatoid arthritis. So vagus nerve stimulation will help with autoimmunity and inhibits cytokine production by about 28 to 32%. Vagus nerve stimulation enhances motor and cognitive recovery, decreases cerebral edema, reduces the breakdown of the blood-brain barrier, and allows for a neuroprotective effect by enhancing synaptic plasticity. This is a very, very interesting study in that mice had autism and they wanted to test the functionality of the vagus nerve. Now, what was most interesting here is that when they gave Arutiri, which is a very positive health promoting probiotic, many or to all of the ASD, autistic spectrum disorder, decreased. When they did that, and then they removed the vagus nerve, even though they continued with the mice, giving them the Arutiri, the mice then had the autism all come back. So probiotics are great, but you have to have a perfectly functioning vagus nerve. Now, one of the ways that I stimulate the vagus nerve very quickly is use a violet 405 light. I've worked that in a laser. I found that to be extremely effective. Hopefully at some time I can go into more detail with that. And I do also have a vagus nerve protocol with nutrition. Having covered that, let's get on to the impact of concussion on the blood-brain barrier. Now, interesting with brain stats, in that the brain is an interesting organ in that it's only 3 pounds, but yet takes 25% of people's calories. It's 75% water, yet 60% fat. It has 80 billion neurons, 1,000 trillion connections between brain cells and the cortex, 60% white matter, and as we said before, it feels no pain. The brain, as depicted in this Giphy, is the most nutrient-dependent, energy-dependent, and toxic and stress-vulnerable organ. Your brain is made of the consistency of Jello. So Jello's moving around in the hardest bone in the body. And interestingly enough, it's the sheer damage to the brain material, damaging the axons, where the concussion rears its ugly head. Women are more susceptible to concussion than men, and women are more susceptible to concussion because pound for pound, they're not as strong in the upper body, and there's a greater whip sensation in a woman, in addition to something called the withdrawal hypothesis. After a concussion, pituitary shuts down. The pituitary shuts down and doesn't release progesterone in women. Progesterone is needed for women because it's a brain healing hormone, so they're not able to recover as quick. They usually have a worse injury, and shocking as it may seem, as a food for thought, their microglial cells function differently in women than they do in men. Here is the molecular cascade of events after a mild traumatic brain injury, or if you will, a concussion. Concussion damages the axons from shearing. However, it can also damage the axons from membrane disruption or excitotoxicity. That excitotoxicity is when the NMDA receptor opens and glutamate is released in excess. When it's released in excess, an excessive amount of calcium is now going from extracellular to intracellular, which leads to plaquing. And potassium leaves from inside the cell to outside the cell. When potassium is inside the cell, it's a great fuel for an axon. However, conversely, when it's outside the cell, it can damage the axon. This can all lead to, as you look, the skull in the middle, apoptosis. In addition to that, it leads to mitochondrial dysfunction by increasing now ROS, reactive oxygen species, ultimately leading to cell damage, which can lead to cell death and apoptosis. In addition to that, it leads to hypermetabolism, to hypometabolism, which can lead to susceptibility to repeat injuries. Concussion can also lead to inflammation via the macrophages. Macrophages are the captain of the ship of inflammation. Microglial cells are the same in the brain. Now, interesting that the men do not have an estrogen beta receptor, therefore their microglial cells don't attack their brain as readily as women. So that's another reason why women are more susceptible not just to concussion, but adverse events post-concussion. The takeaway is very clear here. What inflames the brain inflames the gut. Traumatic brain injury and intestinal dysfunction, we talked about that, and I want to piggyback on just what I said. Researchers from Brown University showed that 6 hours after a concussion, there was actually damage in brain cells. In addition, at virtually the same time, there was an increased permeability and damage to the tight junctions 6 hours after concussion, because you had a release of zonulin and occluded. 3 hours after concussion was the release of LPS. 3 hours. The release of LPS decreases your ability to make that protein enzyme that we talked about before, brain-derived neurotrophic factors, which allow the brain to heal and get brain neurogenesis. However, stimulating the vagus nerve to prevent intestinal dysfunction after traumatic brain injury, we've seen that if you stimulate the vagus nerve, you're able to prevent intestinal injury by reducing the stimulant pathway of NF-kappa B, which ultimately releases cytokines, which lead to this proverbial cytokine storm. So Post-injury vagus nerve stimulation actually, in another study, prevented gut breakdown when it was performed within 90 minutes of injury because it prevented tight junction protein expression. So once again, the way that I like to stimulate the vagus nerve, we do have a nutritional protocol. I use a specific violet light 405 wavelength. So let's go through the related injuries that can occur when you have a concussion. So repeated subconcussions or concussions. You then get the disruption of the blood-brain barrier. It's kind of like opening the door to the brain. You have an entry of unwanted molecules or cells in the brain, leading to an attack on microglia, astrocytes, oligodendrocytes, and neurons, leading to production of antibodies against neural cell antigens, neuroimmunity or neuroautoimmunity, and neurodegeneration. Your brain is essentially out of order. So what do we recommend? I have a Dr. Rob's concussion protocol. So I want to give you a little background on concussion in my office. So really in recent years, I've seen a big increase in the number of patients who come to me for treatment of concussion. In part, that's because more women are playing sports like soccer, which has a high concussion rate. A bigger part, that is, concussion has truly been in the news. So some of my recent revelations about the long-term brain effects of repeated concussions on professional football players have made everyone more aware of the problem. Every year, about 250,000 kids are treated for concussion in emergency rooms, usually playing probably twice the number of that or more by the pediatrician. So they're being missed. So the total number of concussions reported every year is about 3.8 million. And again, that number is probably low. So many concussions in sports and in life simply go undiagnosed and untreated. A lot of my patients come to me because they've been diagnosed and now need help with managing these long-term symptomologies. Well, what is a concussion? Well, a concussion is the most minor form of traumatic brain injury. It means you have a temporary loss of normal brain function. Most concussions are caused by a bump or blow to the head, like in a car accident where it hits something in a vehicle, or a soccer collision when it hits the ground, even from heading the ball. The sudden impact of the blow or jolt makes the brain bounce around in the skull, which damages the neurons and or axons, causing an alteration in mental status and releases the natural chemicals that affect the brain and the rest of the body, which we depicted in one of the previous slides. Really only about 10% of people get a concussion lose consciousness. The most of the damage of concussion is internal. You don't always see a visible bump, bruise, or cut where you hit your head. There's a lot of different options now on blood tests. MRIs are quite vivified. Because there's typically not a visual sign, many people get mild concussions and don't realize it. They don't seek treatment. However, with a concussion, you don't necessarily have to have, again, loss of consciousness, and you don't even have to have a concussion to have damage to brain. So it's a hot topic. It's one that we can all address, and nobody's better suited to help with concussions than chiropractors and their chiropractic training. So my concussion rehab program is a 5-step plan. Number one, we look at the muscular system. So we really need to look beyond just the head. We've already talked about the idea of the bidirectionality of the gut to the brain and the brain to the gut. Every chiropractor, and literature backs this up, should be examining their neck. In addition to that, the COC1 region, the occipital triangle, is most implicated in the shearing injury of a concussion. The muscle that's most injured in that occipital triangle is the rectus capitis posterior minor. So there's a strong musculoskeletal component that chiropractors should look at. In addition, balance training, proprioception, your balance and space between your nervous system and your muscular system, a great rehab advent to allow you to get over that hump. A lot of literature has shown that people post-concussion have a lot of lower extremity injuries, like ankle, knee, and hip, because their proprioception wasn't corrected, wasn't trained, wasn't addressed. Visual disturbances. If you want one grade test without setting for an MRI or a blood test, which both can reveal concussion, test their eyes. 4 out of 12 of the cranial nerves are dedicated to the eyes, and another 2 are almost totally dedicated to the eyes. So gaze stability is something that's typically lost post-concussion. For me, low laser therapy is a great advent. It's a great choice. And just let me give you a little explanation of what laser is. It's actually an acronym for light amplification by stimulated emission of radiation. A laser beam is a focused beam of light that emits photon energy. The key to lasers as therapy is that the light beam can be tuned to specific wavelengths that have known health benefits, but don't give off any heat that could damage tissue. Lasers work on your body through the basic premise of photochemistry. The branch chain effect in photochemistry means that a single photon of light can trigger a reaction in a cell that causes the emission of several more photons. Those photons then trigger emissions in other cells in a chain reaction. The initial signal is multiplied and causes a rapid and regenerative flow of energy through the cells. Interestingly enough, laser, as you'll see, has a lot of positive effects on the body, but especially when we analyze it in the brain, you're going to be quite excited about that. Nutritional support, of course, in a seminar setting, I'll go into more detail. Nutrition is a critical element. Some of the big supplements that I would recommend would be omega-3 fatty acids. Omega-3 fatty acids are shown to help ameliorate the damage from a concussion. Omega-3 fatty acids help axons heal. They're also great in preventing concussions. So if you have a patient who you know is performing in athletic events, giving them omega-3 fish oils would be a great choice. Magnesium L-threonate is another great choice. MIT study 2016 has shown it to decrease brain aging and help people's cognition increase. Turmeric, because turmeric is truly anti-inflammatory. It decreases the NF-kappa B signal, which doesn't allow these cytokines and creates for a microenvironment in the brain to be less inflamed. In addition, it stimulates the NRF2 oxidative pathway, which increase antioxidants. Vitamin D3, D3 with K2, is a great, I'm going to call it a hormone D, not vitamin D, because that has a great positive effect on so many different pathways in the body. And last but certainly not least, L-glutathione, the master antioxidant. Glutathione, 70% brain tissue damage was decreased when L-glutathione was administered. And a diet, for me, the best diet would be a ketogenic diet for concussion because carbohydrates are not a good fuel and can damage the brain, whereas ketogenic diet puts you into ketosis, causing ketone bodies to come out, and ketone bodies are great for brain fuel. So let's take a look at transcranial laser therapy, how effective it is in acute phase of post-TBI. Low laser was effective in the reduction of pain, swelling, and inflammation, improved the cerebral circulation. It also, in another study, significantly improved neuronal function, decreased lesion volume, augmented cell proliferation, and protected the brain against nerve damage. Let's look at these studies about the transcranial laser therapy and how efficacious it was in the acute phase recovery post-TBI. Low-level laser therapy improves neurological performance in TBI. Treatment can stimulate the growth of new nerve tissue, which really leads you down a path. This new nerve tissue is neuroprogenitor cells, leading you to brain-derived neurotrophic factors, leading to brain neurogenesis. On the other hand, it's also been shown to modulate oxidative stress and improve nitric oxide production. Lastly here, low-level laser downregulates pro-inflammatory microglial cytokine expression, which again creates a microenvironment in the brain of anti-inflammation. 635 red light nanometer laser, the one we talked about before, modulates NF-kappa B. Lasers have shown to mitigate cell death. In addition to that, low-level laser improves cognitive deficits and improves microglial activation. So without question, this is one of my favorite slides. Just take a moment and take a look at this. And you'll see this, without question, is one of the most evocative slides that you can conceivably look at, in that it really depicts how a laser affects the brain in a positive light. So let's take a look at this. And the first thing I want you to make note of is that we're at the Journal of Neuroscience Research is the citation. It's not a chiropractic citation. It is the Journal of Neuroscience Research, November 2017. So look at low-level laser therapy or photobiomodulation, which is synonymously called. The red light of 635 is put on the brain, and here are some of the results. You have angiogenesis. Angiogenesis is the increase of growth of blood vessels. You also have the decrease of edema in the brain. You have the increase of lymphatic drainage, increased blood flow, cerebral oxygenation. You get a decrease of neuronal excitotoxicity because it closes the NMDAR pathway, allowing for not an excessive amount of glutamate to be released. Therefore, it's also anti-inflammatory, in addition to being anti-cell death, also finally stimulating neuronal progenitor cells, which stimulate BDNF. So all the things that you heard about and that's been talked about that's damaged in the brain from a previous slide, you're seeing that low-level laser can truly have a positive effect on all those negative effects that occurred because of a concussion. So here's my Dr. Rob laser concussion protocol. I'd like to just get right into where we showed you the big guy, the FX635 for 20 minutes. It's a 20-minute laser program that we position it in different manners. We position it in the temporal manner, and we also position it in the mohawk manner. The vagus nerve, violet light, 30 seconds each side. And those are really the major things that I talk about. The bottom line is I have a 5-prong approach. Laser is a backbone of it. Nutrition, musculoskeletal assessment, balance, and gaze stabilization and visual disturbances. So here's a picture of me applying in my office the laser. And the laser, as you see on the left with Stephanie, and it's in the temporal region right there. You're seeing how that is approached. And then we have Kate over here in the Mohawk version. And in each one of them, there's 10 minutes that they're lasered. Then in addition to it, as I said earlier, if I can go back one slide, we had a vagus nerve stimulation drawing the violet light over the medulla oblongata down through the transverse colon. So in ending, as we get to the finish line, I always tell my athletes to suit up, protect their head, wear a helmet. Then always for all of us, you know, you have a home webinar like this, study up all the information is there for you and it's growing daily. And finally, speak up. If we as chiropractors do not let everybody know that we can handle a concussion, not all of the population will seek us out. Be vocal, let them know that you can help them. And I always like to end with a quote. Sir Oliver Wendell Holmes once said, "A mind stretched by a new idea never returns to its original dimensions." So if you have any questions, feel free to contact me. I'm here for you. It's been my pleasure. I hope to see you soon in person. As I always like to say, Dr. Rob Silverman, always yours in health.